Hi there, my name is Carmel Hauck. My student number is T00701793. We are doing our feline anesthetic induction assignment today on our dental. So his name is Kaiden. He is a 10-year, 10-month male neutered domestic short hair. He had pre-anesthetic blood work and urine testing done, and there was nothing out of the ordinary found on that. Kidneys, liver, heart look great. So we have chosen Hauck or hydromorphone acepromazine glycopyrrolate today for his pre-medication. We've chosen that because he's a senior-ish cat, but he is healthy and has no anesthetic concerns. We had used Hauck previously on a 2021 dental and it worked great. We are finishing up some extractions today. He has some teeth that are needing out, so hydro we've chosen because it has good pain control as well, as it's an opioid. And then our acepromazine is working as our sedative, so we will probably see some of the third eye protrusion, and then it's working as an antiemetic, so hopefully it'll win out over the hydro, which does cause some vomiting. And then finally we have glycopyrrolate, which is our anticholinergic, so we're going to see anti-SLED symptoms. It's going to dry everything out. And then we will see how he does. He did last year need a bit of ISO by mask, so we'll see if he needs that again, but we will do our induction and see what happens. Okay, so this is my clinic mentor, Roberta. We are in pajamas for Vet Tech Week, so it is pajama day. We are now in dental area. This is Kaiden. So he is our patient for our dental. So he had his pre-med. He is fairly sedate, but he will need a bit more sedation before we can intubate him. So we are going to start with our ketamine Valium. So we have that in our syringe, and we are going to give 0.16 millincrements. But first we're going to measure our endotracheal tubes so that we're ready for surgery. So I have 3 sizes. 2 years ago he had a 5 millimeter uncuffed, so we are likely going to be using that tube today. But I also have a 5.5 and a 4.5. So they have a bit of air in them just to check the cuff, but I'm going to now deflate all their cuffs, and we are going to measure them. So we'll start with the 5.5. So you go just cranial to the thoracic inlet, and then we take it to the edge of the mouth. So you just want it to sit a little bit past the incisors. So this one has a bit of dead space on it, so if we do use it, we will have to cut that too. And then we pre-tie our tubes at the corner of the mouth, just because the ruche tubes have the cuff, it's hard to do afterwards. So we pre-tie our tubes to where they'll need to sit. And then we're going to lubricate them as well. So that is our 5.5. Then we'll do our 5. So same thing to the thoracic inlet. This one's a much better fit for him as far as dead space. It sits right by his nose. And then our tie will be about here. And then our 4.5. So again, to the edge of the mouth. So like I said in my intro video, we did have to induce him with some mask isoflurane last year, but we'll see how he does because we do have similar pre-med, but it's slightly edited. All right, so all 3 of our tubes are now lubricated. I am going to put a stylet in my 5 millimeter tube because that's the tube I'm going to start with today. And that just helps hold the rigidity of the tube a little bit to get it in the trachea. All right, so now we are ready for induction. So I have my ketamine Valium, and then I have a flush syringe with saline. So we are going to start with our induction here. So 0.16 mils is our quarter dose. So we're just going to give it by IV slowly. And then a little bit of flush to follow. And we're going to titrate to effect. So we'll see how he does with this. We might be able to spray him with our lidocaine spray now, or we might need a second quarter dose first, but we will see what his jaw tone is like. Was he letting you open his mouth there? Okay, so we'll let him. He's still moving his tongue, so I don't think he's quite ready to be messed with there. So we will note our induction time was 11:32, and we're going to give that a little bit here to sit. All right, so it's been a little bit, about 30 seconds to a minute, and we're going to give our next dose. Okay. All right, so I'm going to see if he's going to let me pull his tongue out of his mouth here so that we can spray him. So I'm just taking a second to visualize his arytenoid cartilages as well while I'm back here to see what size tube I think he'll be today. So I feel like he'll have one more dose at least of our ket valve. All right. So this is our third quarter dose. All right, and he's dropping his head. So I believe he's one of these now, he's holding his head. I think we'll pre-oxygenate him and then we'll see if he wants his final quarter dose. So I'm just getting my mask onto my vein system, and then his oxygen flow rate is 1.3 liters. Although I guess since we're on a mask, we're going to turn him up to probably about 3 liters. Potentially. All right, I think we're going to give it a go. So I'm going to turn my oxygen off temporarily. So we're going to grab his tongue. We have our laryngoscope placed in the mouth. And then we're going to grab our 5mm tube. So I'm just going to visualize his epiglottis and gently press it down so that I can advance the tube. Take out my laryngoscope. And we're going to tie it. So I took a second to visualize that it actually entered his trachea while I was down there. Now we're going to tie. And then before we get anywhere, we're just going to see if there's air coming out of the tube, which there is. So we're going to connect him up to oxygen now. So I know that I'm in the trachea, A, because I visualized it while I was in there, B, because I'm going to feel his trachea and just make sure I don't feel a second tube, which I don't. Then we felt the air coming through the tube, and we also are going to visualize his chest and the bag. Now we're going to give him his final quarter dose just while we're doing this because we don't want him to wake up while we're checking our cuff. So that is his final dose of ketamine Valium. Okay, so we are going to give him a breath to check that that endotracheal tube is proper fit for him. So Roberta and I are going to listen while I close the pop-off valve and give him a breath hold to 15. It sounded good from my end. We're going to do one more. Excellent, and it's holding pressure there excellently, so we know that's the proper tube, which means ISO is going to come on. And then our oxygen as well, we're going to set at that 1.3. And now we are going to change camera angles. I'm going to listen to his chest and get his monitoring set up. All right, so we have moved the camera angle. We added an elbow to this just to have that tube sitting a bit nicer. Now we're going to put on our pulse ox so that we can see his SpO2 and his pulse. So we're going to put that on a tongue. We may not have it on his tongue for the whole dental just because sometimes it gets in the way of x-rays, but you can put it on any thin surface. And then we'll have that here so we can see the heart rate. And now we're going to do the Doppler as well. So that is anticipated. We did have glyco, which increases the heart rate a little bit. So I'm shaving that back leg here, and then I'm going to listen to the chest before we get that Doppler finished. So the final confirmation of making sure that my tube has been placed properly is bilateral chest auscultation. So Roberta's going to give a breath while I listen. So I hear breath sounds on that side. And the other side as well. So we have confirmed that we're in the trachea. And now I am going to finish here with some alcohol. And then we're going to get our ultrasound gel. So we just place that on the shaved patch, get our bandage to hold it in place, and then we'll turn it on. Nice strong Doppler there. And then it goes with our blood pressure cuff. And we'll turn that back on for a reading. All right, so blood pressure is about 96 currently. And then the one monitoring equipment we don't have is an esophageal stethoscope. So briefly to explain, we would lubricate that and place that into the esophagus, dorsal to our endotracheal tube. And to measure, you go to the 5th rib. It just kind of sits right at the heart. But we don't have that equipment, so we'll explain it to you. And then to confirm that we are in the proper stage of anesthesia, so stage 3 plain 2, we can see that our respirate has regulated, it's normalized, we're getting nice, calm breaths, and then our heart rate's normalized as well. So we're currently sitting at 139 beats per minute. Now, the other things we're going to check are some of our reflexes. So we'll check a pedal reflex. I'm going to pinch her toe, and she's not drawing it back or acting like she can feel that. And then our palpebral as well. There's no blank. And then jaw tone we've checked as well, so that there's no movement. She doesn't respond to tongue or anything like that. So we know she's in the proper stage of anesthesia for surgery. Okay, so his dental is completed. We've done all of his extractions, and now we are ready to turn him off gas and wake him up. We are anticipating a very fast wake up, so I do just want to quickly explain the cautions we need to take when we're extubating. So with cats specifically, we have to be worried about laryngospasm. So when extubating, you want to be super careful to avoid any tracheal damage or rupture. And with cats, we extubate at first sign of movement, even before a swallow. So it's an ear flick or eye movement or body movement will extubate. So first we're going to turn him off the gas. So ISO is off at 223. So now he is just on oxygen at 1.3 liters again. And then I'm just going to get my tie loosened so that when we need to extubate, we're ready to go. But we won't move him from this position. And then I'm just going to be checking a palpebral and for an ear flick here and waiting for him to wake up. He's got a very slight blink. No ear flick. You can hear his heart rate starting to come up here. And then we can just kind of gently start to stimulate him. Alright, so since he's got that blink, we're going to extubate him here now. So just one quick movement. And we're going to make sure his head's adjusted well, and we're going to wait for him to get in a dorsal. Sternal. So I'm just going to give him this blow by here while we're here. So as he's recovering, we're just watching his heart rate, his rest rate, making sure he's staying warm as well. So we've got his kennel ready to go, all warmed up. He's starting to look at me here now, so he's getting nice and woken up. Model. It's okay. I'm tired. Mm-hmm. He's just starting to move his head here. Sugar. Not put your little face in the towel. So we're just going to keep him here until he can hold his head up on his own, and then we'll move him to his recovery kennel. So he's moving his head well. He's got a bit of the disease, but he just wants to go back to bed. So he's holding his head up and he is sitting in sternal, but he's gonna have a bit of recovery left to go. So we'll move him to his recovery kennel here, and then I'll continue to monitor him, and I'll check back in. Okay, so we have Kaiden moved to his kennel for recovery. So he's gotten his post-op analgesia, and now we're just going to make sure that he's waking up okay in the kennel. So we want to watch for any signs of irritation of the throat, so coughing or discharge from nose or mouth. And then we will make sure he gets nice and warm. The kennel's preheated, and there's a heating fan on in this room. His temperature was 37.4 when we woke him up from his dental, so he's doing all right. So you can see he's moving his head about, he's holding it up. He's still a little bit sedated, but we will keep an eye on him for the next little bit. I'm going to take a quick TPR and make sure he's doing all right. He'll let me do a CRT. Perfect. Capillary refill time looks great. Take a TPR here. All right, so his his pulse is about 160 right now. He's actually purring, so it's hard to hear, but his lungs sounded clear through the purrs. Right, Sugar Bear? So I'm going to sit with him for a bit just to make sure he's recovering well, and he is still on IV fluids, and he still has his catheter in, so we'll remove that once he's a little bit more awake, and then he'll be good to go home.